Plastic surgery, reshaping our bodies with knives and stitches. It's as modern medicine gets. But is it really all that modern? There's new evidence to suggest that people have been having themselves surgically altered for thousands of years. As ancient warfare forced ancient physicians to learn more about human anatomy, more kinds of surgery became conceivable, including plastic surgery. There were nose restorations, breast reductions, eyelid tucks, facelifts, counter-circumcisions, and maybe even a sex change. The story of plastic surgery involves some of the best-known names in ancient history. Alexander the Great, the beautiful Queen Nefertiti, and the grandest of the pharaohs, Ramesses II. And it was all done without modern anesthetics. Did patients then just bear the pain, or did ancient surgeons have other ways of controlling it? How much was known then that might have been forgotten now? That's what surgeon Natasha Hidvegi would like to investigate. She's part of a British team working on the idea of growing cartilage independently of the human body, of making living structural frameworks to order in the lab. It's almost possible, but not quite. And Natasha wonders if keys to plastic surgery breakthroughs can be discovered in practices more than 2,000 years old.
Time and time again, I read about the history of surgery and medicine and about operations that were lost in the passages of time have been reinvented or rediscovered today. And I'm sure there must be many practices that were used in ancient times that perhaps we can rediscover and use in modern medicine today.
In her search for the secrets of the early plastic surgeons, Natasha travels across 3 continents. She visits ancient sites and studies ancient records, hoping to find, in the extremely old, knowledge that can advance the newest of new. The Ganges, where it flows through Varanasi, one of the holiest places in India. Varanasi is both the city of Buddha and a destination of pilgrimage for millions of Hindus who come to bathe in the holy river. It's an ancient city, and like many centers of religion, it has also become, over thousands of years, a center of learning, literature, and science. And part of that science, as Indian physicians have long known, was the development of plastic surgery. So Varanasi is where surgeon Natasha Hidvegi begins her expedition into her discipline's past. Natasha wants to find out what the earliest Indian doctors knew and how they worked, to see if their techniques have anything to offer surgeons today. There's an ancient legend that Natasha has heard. In India, in 1500 BC, a princess is caught with her lover, and her furious husband commands that she suffer the usual penalty for adultery, to have her nose cut off. It's agonizing, disfiguring, and worst of all, a mark of shame. She will always be an outcast. But her father, the king, has other ideas. He orders a physician to repair his daughter's beauty and good name by restoring her nose. And the physician proceeds to do just that, becoming the first plastic surgeon ever mentioned in history. And 3,500 years later, the same techniques are still being used by modern plastic surgeons. Natasha is visiting a center of the ancient skills, the Hindu University Hospital, home of Ayurvedic medicine. Ayurveda is one of the oldest known medical disciplines. It means science of life. Its approach to the body is philosophical and holistic. And it follows principles laid down in 500 BC by the great physician Sushruta, who recommended, among volumes of other things, using leeches to keep wounds free of blood clots.
So shape is like just like Porsu shape it.
Yeah.
So this is
when it's going
actually mentioned in Sushru Sangita.
Oh really? By Sushruta?
Yeah, this is very classical picture.
This one's got quite fat.
Yeah.
Already from feeding, you can see it coming in.
You can see the blood is coming like.
Peristalsis coming in. And this helps the ulcer by relieving the venous congestion.
Venous congestion.
And stimulating more blood flow.
Yeah.
Ayurvedic medicine has a long tradition of using leeches to help with wound healing. Unfortunately, it's only recently been rediscovered, especially in plastic surgery, to help in congested tissues, especially in wounds and in flaps that we use for reconstructing body parts.
Western medicine, having once abandoned leeches, is now using them again. Is there anything else in this ancient discipline that the West could rediscover? Sushruta's general advice to physicians, written in his Principles of Ayurvedic Medicine, would certainly apply to doctors anywhere and in any age. A physician who has set out on this path should have witnessed operations. He must be licensed by the king. He should be clean and keep his nails and hair short. He should be cheerful, well-spoken, and honest. The compendium goes on to describe such things as good diet and herbal remedies, but also some extraordinary surgical techniques, including the revolutionary nose reconstruction. There's no way of knowing when this surgery was actually developed, but Sushruta's is the earliest known written record. He even describes instruments. Professor Sahu, head of Ayurvedic medicine, takes Natasha through them.
Then different kinds of knives they have described.
These are the scalpels?
Yeah, blades they have described. You can see the different tips, their angles, and sizes also for different type of surgery, different type of instrument they have described. Then
this is very pretty.
Yeah, that's a very
with a bird in it.
So this beak you see, it's quite long, so one can take a foreign body from a deeper structure. So there are smaller beaks.
Pictures and text are fine and revealing, but Natasha is a surgeon and would really like to see Ayurvedic surgery in action. And then, the day after she arrives, she has a stroke of luck. A chance to see not only an operation, but an actual nose reconstruction. 8-year-old Jaya, injured last year when a power cable fell across her face, has been brought to the hospital by her family.
Can she breathe through this nostril?
Yeah, she can breathe well.
Everything's fine? So
yeah, everything's fine.
This is an electrical burn?
Yeah, this scalp burn also, the deep scalp burn, you can see the pulse.
Her skin, she's got she's such a small child for her age. Okay, thank you. She's very lucky to have survived.
Yeah, I feel she's quite lucky.
Tomorrow, Jaya's nose will be rebuilt by almost exactly the same method Sushruta described 2,500 years ago.